Hi, I'm Dr.Geoffrey Channon Reed, and welcome to Focus on Your Health. I'm a board-certified chiropractor specializing in functional neurology and brain-based therapy. Of 60,000 chiropractors nationwide, I'm one of only 3,000 functional neurologists providing brain-based therapy. Our mentor is Dr. Michael L. Johnson. He's the author of the alternative medicine bestseller, What Do You Do When the Medications Don't Work? A non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. Now, Dr. Johnson is one of only 1,200 board-certified chiropractic neurologists in the United States, and he's the head of our fellowship, through which we develop all of our treatment protocols. You can go to our fellowship's website. It has all the doctors in our program and our patient testimonials on it. That's located at www.lifechangingcare.com. That's lifechangingcare.com. In our fellowship, we work together to do exactly what I'm going to talk to you about today, and that is treating chronic and difficult conditions like yours or that your loved ones may have, and also how we get them better faster and sooner than anybody else out there. I'm also here to tell you what makes us different from everybody else. Now, just a few of the chronic and difficult conditions we treat are fibromyalgia, chronic fatigue syndrome, dizziness, BPPV or vertigo, ADD, ADHD, migraine headaches, autism and autism spectrum disorders, numbness and paresthesias, insomnia, restless leg syndrome, RSDS or reflex sympathetic dystrophy syndrome, tinnitus or ear noises, dystonia, carpal tunnel, and of course, arm, neck, leg, and back pain. Now, chronic health conditions like yours can include a host of other symptoms such as photophobia or light sensitivity, hyper-hydrosis or increased sweating, irritable bowel syndrome or IBS, an increased and or irregular heart rate. You may have a combination of these symptoms. They may come and go, they may wax or wane, they may not be present all at the same time. See, the treatments that I recommend have worked for tens of thousands of patients nationwide. Currently, I have over 1,000 doctors that I work with closely in the treatment of these life-robbing conditions. So I guarantee that no one has told you what I'm going to tell you today. In my clinic, I leave no stone left unturned to determine the exact cause of your problem. So I'd like a few minutes of your time to address, 1, how do I successfully treat your condition? And 2, what makes my program unique? So how do I successfully treat your condition? By using specific metabolic and neurological protocols. First, we do specific sensitivity testing for foods. We start with sensitivity testing to determine if you have a sensitivity to gluten, which is in wheat, rye, oats, and barley, or a sensitivity to milk, eggs, yeast, or soy. If you're sensitive to any of these food groups, it could be making your chronic condition worse, as it will increase inflammation in your brain and throughout your entire body. You may be sensitive to more than one of these groups. And here are just some of the symptoms of these food sensitivities. There may be chronic pain or fatigue, frequent indigestion, feeling bloated after eating, frequent loose bowel movements or constipation, mouth ulcers or sores, and even frequent vomiting. The only way to find out if you're suffering from any of these sensitivities is to run the tests. I also have specific metabolic testing done. We do complete blood panels. By using specific blood tests such as a thyroid panel, a complete metabolic panel, a lipid panel, a CBC, that's a complete blood chemistry, we can assess your thyroid, adrenal glands, liver, kidneys, red and white blood cells, and gut function. Now, any and all of these can be effective with chronic health conditions. By addressing any problems with your thyroid, adrenal glands, blood chemistry, or gut function, we can help you heal faster. The CMP also allows us to check your blood glucose levels, since glucose and oxygen are the fuels required by the brain to function properly. We'll also want to determine if there's an active antigen or dysregulation. Active antigens are parasites, bacteria, viri, molds, yeast, fungi, protozoans, foods, chemicals, and heavy metals. The best indicator for an active antigen as the cause of an abnormal dominance is the helper-suppressor ratio on the T and B cell panel. It's also called the CD4-CD8 ratio. We may want to do intestinal permeability testing. This is used to determine if you suffer from leaky gut syndrome, or LGS. LGS, or leaky gut syndrome, describes a condition of altered or damaged bowel lining caused by antibiotics, toxins, poor diet, parasites, or infection, which can then lead to increased permeability of the gut wall to toxins, microbes, undigested food, wastes, or larger than normal macromolecules. It's been proposed by some that these substances may affect the body directly, while others postulate an immune reaction to these substances. There are also hormone panels. We can check hormone panels to determine if you suffer from low testosterone for men or low estrogen or progesterone levels for women. Symptoms related to decreased hormone levels may include, but are certainly not restricted to, depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, and decreased physical stamina. We then utilize specific neurological testing and treatment. For example, I use oxygen therapy in my clinic. Oxygen is fuel for your brain and nervous system. Your brain and nervous system need two things to survive: fuel and activation. Fuel comes in the form of oxygen and glucose. By using oxygen, we will help you heal faster. By using exercise with oxygen therapy, EWOT, we can increase firing to the brain. By increasing activation of the brain, we help many chronic conditions. Think about oxygen this way. You can live for 30 days without food, 3 days without water, but only 3 minutes without oxygen. You'll find a more in-depth discussion of oxygen and why it helps you get better faster at my website, which is located at www.clintonnjchiropractor.com. That's www.clintonnj, as in New Jersey, chiropractor.com. For many conditions, I use brain-based therapies. We may use a specific brain-based therapy such as vibration therapy. Vibration fires the back part of the brain called the cerebellum. One of the functions of the cerebellum is to control the spinal muscles. If the cerebellum is not firing correctly, there may be muscle spasms, back pain, or even disc problems. We may also use auditory, visual, olfactory, and caloric stimulation to increase firing of the brain. These are used to treat the areas of the brain that are causing your problems. Once we've run the necessary tests to determine your specific condition, we can successfully treat you via appropriate neurological and all-natural nutritional protocols. Now, I want you to take a minute to ask yourself the following questions. 1. How has your condition affected your relationships, finances, family, or other activities? 2. What does it cost you in time, money, happiness, or sleep? 3. Where do you picture yourself in the next 1 to 5 years if this problem is not taken care of soon? And 4. What is it worth to you if we could improve your condition? So here's what to do next. If you're really serious about the possibility that there could be an alternative treatment for you or your loved one, please call our office at 908-735-8988 and tell the staff person that you're interested in setting up a free screening to see if we can help you. Over the past 25 years, our fellowship has successfully treated tens of thousands of patients. Will you be our next success story? I'm Dr. Geoffrey Channon Reed, and I thank you very much for your time, and I hope to be able to help you soon.